Well, here's our PRP that our patient is going to have injected into his shoulder, along with AmnioFix, which is a stem cell matrix that's purified from placental membrane and amniotic tissue, and he's also going to receive our ozone protocol.
And how long have you been dealing with this pain?
About 6 months now. We've had some prior treatments done, some deep tissue release, and we've done some ozone.
Yep.
And that really loosened things up and got my mobility back, but still not 100%. So what are we putting in now?
This is the numbing mix that we put in that has some healing agents in.
Mm-hmm.
Then we'll do the PRP.
Right.
And then I'll put the amnio matrix. That I'll put right into your shoulder.
Mm-hmm.
Because that clicking's coming internally.
Right. So it'll be a deep injection.
Yes. Ashley, do we have a long 22 needle? I've seen them.
Is that the longest you have?
Oh, he is.
Good.
A little pressure on that one.
Right there?
Mm-hmm.
Yeah, because I'm right against your bone and shoulder capsule. Good. Now I'll take the just that amnio matrix. Some pressure.
Just a little.
This capsule.
A little pressure.
Okay,
Not terrible.
good. Now we'll put the ozone.
1,500 employees down by Venice.
Feel that in there?
Mm-hmm.
Okay,
That's the deal.
that's the deal.
Not bad.
Well, Carl, basically you got the ozone treatment with the PRP, the ozone, the AmnioFix, and you've been taking our RejuvenateYou Nutritional Support 45 for 2 months now. And we gave you the injection in your shoulder last Thursday.
Correct.
So tell us about the problems you were having prior to the procedure.
About 6 months ago, I injured my shoulder serving tennis. And it was so painful and so discomfortable, I couldn't even lift my arm past my shoulder height. So as a result of that, I went to see Dr. John Pro, who has this active release technique. It's a chiropractic type method, and what he does is he massages the deep tissues of your muscles so that you can get, the body will repair the damaged tissue. Well, after about 3 or 4 treatments, I did get somewhat better, and then Dr. Pro suggested I come to see Dr. Bino and go for some of these ozone shots, which he thought might be very beneficial for me. So I met Dr. Rucker, and he went and ahead and gave me the ozone. And sure enough, within 5, 10, 15 minutes, my arm was a lot looser, and I could raise it a little bit higher. We repeated that probably 2 or 3 times over the course of a couple months, I would guess. And I started getting a lot better mobility. I was able to play tennis again, and I was feeling pretty good about myself. And at the same time, when I went for the first set of ozone shots, we also went on some of these other, I forget what you call it.
The RejuvenateYou Nutritional Support 45.
Right.
The elk antler. Yeah.
And that gave me a bunch of energy and feeling great. Then last week we went and did the total procedure with the amnio and the stem cell and whatever else was in there. And this procedure went like clockwork, and the following Monday I was playing tennis. Feeling great, got plenty of motion, can swing, can play tennis, can run. Everything is as good as can be expected.
And you've had the most miraculous recovery of anyone we've treated. So, and this would be a procedure you'd recommend to any of your friends or colleagues dealing with any similar issues like yourself?
Absolutely. As a matter of fact, my best friend is a gynecologist, and he had this type of treatment done several years ago on his knees, and it has kept him from having a replacement knee surgery, and he's able to play tennis again. So I know this procedure is, whoever gets it done has spoke highly of it.
Great.
Very successful.
Thank you for your time, Carl.
My pleasure.